KKT technology was developed many years ago with the assistance of my whole team of doctors and engineers and scientists. And it was developed utilizing very advanced forms of diagnostics and a very, very precise form of analysis in order to see how the body was compromised and how it was distorted and how it was disfigured and how it was dysfunctional. So all the analysis and all of the detailed forms of diagnostics that we used were put together and incorporated in order to give us a very clear signal of what had happened to any one individual. And then along with that, we developed then the technology for using sound waves to realign the body and bring the spine back and the nervous system to start to function the way it was designed to do. Are there any side effects associated with this? So far, the great news has been that we have yet to encounter any known side effects to the treatment. It utilizes very detailed sound waves, not ultrasound, but sound waves, which have been known to be extremely safe in the kind of doses that we're administering. The treatment of the neck and the back has always been very interesting because it has been somewhat of an enigma. It's been a difficult thing to pin down, and we have been able to very clearly show that by the procedures we're utilizing, we've made a very dramatic difference to these conditions. Conditions that were thought to be difficult to treat, we have made relatively easy. And over and above that, I think the reason why you're asking this question is because it has become also very evident that when the spine is properly treated, we find that any system or organ that is related to the spine, without any doubt, any question whatsoever, whenever there is a relationship of the spine to any organ or system, then once we correct the spine and we restore the function of the spine back to normal, then we look and we expect to see that the changes in the entire body systems will have improved. The question about how KKT has impacted the rest of the body has become a very, very interesting discussion. We already were very, very clear on the fact that KKT did affect, and it does affect, the neck and the lower back. The neck and the lower back has always been an enigma. It's been a very difficult thing to treat in the past. But of course, we've made it relatively simple and very effectively done through the process that we've described earlier. What we have also become very clearly impressed about is the fact that when treated and when the spine is restored back to normal, the entire working body goes through a transformation, through a change. And this is very understandable because once the spine and the nervous system has been managed in an effective way, it only makes sense that all the organs and the systems that are attached to the spine would effectively have been improved upon from a functional standpoint. And so, to clearly answer your question, yes, we're finding more and more that a number of systems are affected by the spinal column. This is something that we were taught in medical school, but we never understood it effectively when we came to treating patients on a day-to-day basis. KKT has brought that to the forefront. We have become, as physicians, more capable of understanding how the spine is affecting the multiple systems in the body. And essentially, what is interesting now for us is the fact that we're able to affect that. A study we did about 2 years ago on the neurotransmitters in our body. These are little chemical signals that are released from the nerves in the brain and in the rest of our body, showed that when we treated, after the KKT treatment, we were able to bring these neurotransmitters back to normal. This was unheard of. Nobody had ever thought that this might in fact be the case. And so there are a number of conditions today that we feel that without properly assessing the spine and treating it effectively,